Hello everyone, my name is Miriam Mutebi and I'm a breast cancer surgeon. I'm here today to talk to you a little about breast cancer and how you can collectively improve your breast health. So the management of a breast cancer is a multifactorial, multidisciplinary approach, meaning that there are many different components of the care. But what is important is, one, first confirming the diagnosis. And once the diagnosis is confirmed, the next step is to confirm what is the stage of the cancer. There's different stages of cancer, stage 1 to 4, and what we call stage 0, which is like a pre-cancer. But depending on the stage of the cancer that you have, it's important to realize that treatments are available, but the goals of treatment might change. If you have an early cancer or a cancer that is confined either to the breast or to the glands under the arm, which is the next place that breast cancer spread, then treatments might involve a combination of either surgery, chemotherapy, which is medication you give through the veins to try and control the spread of the cancer. You could have radiotherapy, which is a special type of X-ray that is designed to sterilize the area where you may have had your surgery, and hormonal therapies. But these depend on, one, the stage of the cancer, and two, the type of breast cancer that you have. When you say breast cancers, it's almost like saying painkillers. There's different types of painkillers. There's Maramoja, there's Disprin, there's Aspro, and they all behave slightly differently. And it's the same thing with breast cancers. So when you have a diagnosis, it is important to know, one, the type of cancer that you have, two, the stage of the cancer the stage of the breast cancer that you have, and what will happen is you will have a multidisciplinary team involving, we've talked about all these different treatments, the medical oncologist, who's the one who gives chemotherapy, the radiation oncologist, who gives the radiotherapy and possible hormonal therapy, the surgeons like myself, the surgical oncologist, the pathologist, who's the one who takes the biopsy, and the radiologist, and we all sit down together as a team to come up with a customized treatment plan for you. And so it's important to have that multidisciplinary team input even before you start your therapies, so that the appropriate treatment plan comes up. And then once that is done, depending on the aims of the treatment, as I said, early cancers are aiming at cure and may have more aggressive therapies upfront, whereas if you have metastatic cancers or cancers that have already spread beyond their primary site to other areas, then the mainstay of treatment might be either tablets or chemotherapy, and that would have a different regimen. Keep in mind that the goals of treatment may change. In one, you're treating to cure, but in the other, you're treating to control, but there's always treatment. So it doesn't matter, irrespective of the stage, there's always treatment and something that can be done to try and control and potentially cure your cancer. I would say the main cost drivers of care are the fact that cancer care, unfortunately, globally is not cheap, and the diagnostics, just even coming up with the diagnosis, you have to do the biopsy, you have to do the staging, maybe do a CT scan of your chest and abdomen, or sometimes more sophisticated tests, and then you have to go through the treatments, whether it's surgery, chemotherapy, or radiotherapy, and all these have financial implications, which frequently result in patients getting financial toxicity, mainly because quite a number of patients have to pay out of pocket for their cancer care. The National Hospital Insurance Fund has tried to mitigate some of these costs by covering or supporting some of the costs of care, but quite a number of patients still experience catastrophic health expenditure, meaning they end up breaking the bank. And then, of course, there are the sort of hidden I would say effects of the care and the therapies, where you're sort of maybe struggling with discrimination at work, you're losing your job, your source of livelihood, and so all these factors ultimately end up impacting our patients negatively.